Well, there's grave fears Adelaide is facing a second wave amid a coronavirus cluster growing to 20 cases. Hundreds have spent the day in testing queues for up to 10 hours as health authorities scramble to contain the outbreak. The Australian Medical Association is optimistic that the cluster can be brought under control. Joining me now is the Vice President of the AMA, Dr Chris Moig. Chris, great to see you tonight. You're optimistic, your organisation is optimistic that this can be brought under control. Obviously, the contact tracing capabilities in Adelaide you have full confidence in.
Well, I think the word is cautiously optimistic. Unfortunately, a good description is like when you're trying to fill a beanbag, it only takes one of those little balls to get out that we've got a major problem after that. But cautiously optimistic. The response has been very definite. The contact tracing has really, the whole machinery has really ramped up immediately. And it's not just South Australia. One has to actually thank the other states. As the whole model is supposed to work, the other states have helped out, and also the federal government have already stepped in to offer help with contact tracing. So there's a lot of contact tracing ability all working on South Australia at the moment to try and get in front of the cases. So far, so good. And I've had independent advice sort of giving the impression that we've got things under reasonable control at the moment with reasonable confidence.
Now, the PM has sent in the troops, basically saying that the South Australia can have whatever resources they require to try and get this under control. That's obviously also very important going forward.
Well, this is the way it's supposed to work. I mean, obviously, last time when things happened in Victoria, I think we were in a completely different position. First up, the thing had been brewing under the bonnet for yonks, and a large number of cases had already occurred. So contact tracing wasn't very feasible. But also, to be frank, the contact tracing standards there were pretty terrible at that stage in Victoria. They've really increased. And I think everybody's learning from each other, and that's what should have happened, has happened across Australia. The contact tracers have really learned from each other, and now they're all working together as one as well. So that's actually this is the way it's supposed to work. If there's a hotspot, everybody comes in to help to try and contain it, because it's not just about South Australia, it's about the rest of Australia. Knocking these out is in the interest of everybody.
It sort of lends weight to the theory, Chris, doesn't it, that suppression is the model that we're looking at here in this country until we get a vaccine. Eradication is just too big an ask, isn't it?
Well, let's not quibble about that whole thing. I think really having no cases is still preferable, because unfortunately it is an incredibly infectious condition. I think we've called it aggressive suppression, which essentially means no community spread, which is really where we need to get to, because this has only just taken essentially a very minor slip up, it sounds like, in hotel quarantine, which is always going to be our biggest risk, to really lead to a closing down of a large amount of Adelaide, 4,000 people quarantined at the moment, and really very, very definite decisions to get in front of this to try and control it.
Dr Moy, just quickly, how would a vaccine be rolled out? For viewers at home right now, there's talk that it could be as early as March. I mean, the most likely scenario is mid-next year. But people are quite bullish, particularly people like Pfizer and the University of Queensland. How would it be rolled out? Would it basically be mandatory for the public to take the vaccine? And, would they go to their GPs to get it done? How would it work?
Oh, look, at the moment, the thought is that it's mainly going to be general practitioners along with respiratory clinics and hospitals that are going to be the ones. There are significant logistical problems, definitely with the Pfizer one, maybe less so with the Moderna one, in terms of transport and storage. And so there's a major logistical problems, and it needs to be a lot of planning. So the AMA is very much involved in that. Now, there needs to be kind of two lots of decisions. The first decisions are about who gets it first. And, I think the ones that are being looked at are the frontline health workers and also workers who are potentially exposed first up, emergency workers. Obviously, consideration for those at risk. And particularly the elderly and those with major conditions. They're the ones we've got to make decisions about that. And then there really needs to be major and complex decisions about the whole distribution process, and making sure that it's make sure that the vaccine is kept intact and will still work at the point when it's used, that it's supplied in a COVID-safe manner. You've got to remember that. We've got to make sure that we don't infect people while we're giving them the vaccine, and also to make sure that there's security for the vaccine, because I think there's obviously going to be some possibility that people are going to be trying to get ahead of the queue and try and get access to it by whatever means.
Sure. Well, Dr. Chris Moy, thank you for joining us tonight on Sky News Across Australia. Really appreciate your time.
It's a pleasure.